Now we're going to talk about safety in the laboratory. All right, so the Occupational Safety and Health Administration, or OSHA, actually has regulations that are designed to help inform workers about the hazards that they can come across while they're working. And it kind of also is there to help protect them from any harm. So the regulations are revised as needed, so things do change, so those sometimes can be changed as well. That helps to basically increase the workplace safety if there is new information that came available, or if there's additional hazards that have uh, come up in the work area. So you should keep up to date on all relevant information as it can change throughout your career. Types of safety hazards that you may run into are biological, physical, sharps, and chemicals. So biological would be like an infectious agent such as like HIV, hepatitis B, C, things like that. Physical would be your wet floors or lifting something that's heavy. Sharps would be needles, lancets, or even broken glass. And then chemicals are anything like a preservative or reagents are things that you may run into the laboratory. You may also run into radioactive reagents, X-ray equipment, electrical. There are some high voltage equipment that is used in the lab. You have fire or explosive hazards as well. So open flames can be used sometimes, oxygen and chemicals. There are also gases sometimes under pressure, so like in the big tanks. And then there's also latex sensitivity. So some people actually have an allergic reaction to latex that can be found in gloves or tourniquets. So, basically, despite their goal of promoting health, healthcare facilities can be dangerous places for people who are not aware of the potential risks. So that's why we make it be known for everyone so they are aware. So general safety precautions to keep you safe is to practice hand hygiene, which we will talk more about in chapter 4. Making sure that you're always wearing that personal protective equipment or PPE when you're handling specimens. PPE would be things like gloves, face shields, goggles, your lab coat, things like that. Not all of those are always needed, but you will learn which ones you need to wear and which ones you maybe should wear certain occasions and things like that. Make sure you are avoiding touching your face, nose, or mouth if you're in the work area, and do not rub your eyes. You don't know exactly what's on your gloves, and you don't want to find out by putting it in your mouth or your eyes. Make sure you never store food or beverages in the lab refrigerator if the refrigerator has reagents or specimens in it. The refrigerators in the lab will be labeled as such, and it will say something of the nature like do not store, food or drink in here. Usually labs will have a break room, and then that would be where you can store those types of items. Make sure you don't let anything hang loose that might get contaminated or caught in equipment. So an example of that would be like an ID badge on a lanyard. They don't really allow those anymore for this very reason. And also making sure if you have long hair to keep it pulled back as well. Make sure you protect your feet from spills, slips, and falling objects. So make sure you wear shoes that are appropriate for the laboratory. So making sure, they're not Crocs, with the holes in them, or sandals or anything like that. Generally you want like a hard top shoe. You don't want a needle going into your foot. And then avoid putting anything in your mouth in the work area. So physical hazards, most of these are going to be common sense. So avoid running in the work area, watch for wet floors, make sure you bend your knees when you're lifting heavy objects or transferring a patient. So make sure you familiarize yourself with proper lifting techniques that can be found in your textbook. And then maintain a clean, organized work area. Sharp hazards. Sharps are actually the most common hazards that phlebotomists will encounter. So if you think about it, you're dealing with needles all day, right? So there's always that chance of sticking yourself with a needle. So make sure you are always using that safety engineering feature, which we'll talk about later. Never detach the needle from the plastic tube holder, and make sure you dispose of all those sharps in a potential sharps in a puncture-resistant container immediately after use. So if you look at the screen, the bottom right picture down there, that red container is actually a sharps container. It's kind of like a thicker plastic, and that just basically protects, yourself, housekeeping, patients, other healthcare people, visitors. It protects everybody from the sharps, basically. So it reduces that risk of people getting stuck by a needle. Sharps are dangerous, both because of the physical injury they may cause and because they may also have a bloodborne pathogen on them, such as HIV, hepatitis B, hepatitis C. So we want to make sure that we have those, properly contained so nobody is unintentionally exposed to those. Needle Stick Safety and Prevention Act of 2001 was introduced, and it actually requires employers to switch to safety needle devices. So the picture down below actually shows an example of one of those safety needle devices. So that orange piece that it looks like they're pushing down on with their thumb is actually the safety device. So after you draw the blood on the patient, you use that and just push it down, and it actually clicks in place and covers the needle. And that makes it so, the needle is no longer exposed, and people shouldn't be able to accidentally, stick themselves with it anymore. This act also required employers to solicit employee input in choosing a safety needle devices. So this actually made it to where employees had a say in what they are using. And it also kind of showed that they could impose high fines for failure to comply with this act. Procedure after a blood exposure. So this is going to determine on where you are working. It could be a little different, but generally what happens, so if you have an accidental needle stick, because it can happen, accidents happen, we're all humans, but what you would do is you are going to immediately flood and wash it with water. And then you're going to clean it with soap and water or a skin disinfectant. So generally you are going to run it under, running water for, usually it's about 15 minutes. After that, you're going to report it immediately to your employer or supervisor. And then from there, you're going to seek immediate medical attention. It's really going to just depend on your facility's protocols and what they will do as far as any testing and things like that. Some will go ahead and test for HIV, and others will actually start on some medications depending on the circumstances. Chemical hazards. So we have the OSHA Hazard Communication Standard, which actually requires all chemicals to be labeled. The labeling procedure is called a Globally Harmonized System, or a GHS, of classification and labeling of chemicals. So these labels must have the identity of the chemical and the chemical manufacturer on them. They must also have the proper hazard warning with the pictogram. So if you look on the right-hand side in the middle, there's like a little diamond shape. Those are actually the pictograms that we're talking about. So some of them have a flame, some have, a skull and crossbones. That just kind of gives you a brief overview, essentially, of what this chemical is capable of. It also should have an explanation of the hazard, and it should also have first aid measures in case somebody is exposed to this chemical. Never use a chemical that is not labeled. So if it's not labeled, we don't know what it is, right? And if we don't know what it is, we won't know how to properly help if you become exposed, and we won't know how to properly clean it up either. So make sure you never use anything that's not labeled. OSHA requires that each chemical come with a safety data sheet, or an SDS sheet, and the Department of Transportation label or a National Fire Protection Association label may be used to identify hazardous materials as well. The safety data sheet has 16 different sections in it, and it provides information about the chemical, its hazards, and the procedures for cleanup and first aid if needed. So the SDS was actually used to be called a material safety data sheet, so an MSDS, but now they are just called an SDS. So trying to reduce the risk, most labs are going to have a chemical hygiene plan in place. And the hygiene plan will help to describe all safety procedures, special precautions, and emergency procedures used when working with those chemicals. You're going to try to treat all chemicals as hazardous and make sure you always wear the proper PPE when handling. Follow the protocols and instructions carefully. So for instance, if a protocol says to add acid to water, don't do the opposite and add water to acid. There's a reason it says that, right? So make sure you're following these instructions. So when accidents happen, because they do, we're human once again. So despite precautions, chemical accidents can occasionally occur. In such cases, you must be prepared to act quickly to prevent or minimize a serious injury, and make sure to report that accident to the appropriate supervisor. Make sure you're always using the appropriate PPE when working with chemicals, including eye protection, lab coat, and gloves. If that chemical that you're working with does spill on you, like mentioned before, make sure you flush that affected area for a minimum of 15 minutes, then proceed to the emergency room or whatever your facility's protocol is. If the chemical spills on the floor or work surface, also you need to alert personnel of the danger and then follow that laboratory protocol for cleanup. So it may seem simple, you spill something, you're just going to get a napkin and clean it up. That is not always the case on what you should do. So make sure you consult the SDS and how you should be cleaning those up. Some really do only need a napkin, but others will need special powders to help neutralize whatever you're working with, and some others have other things that are needed as well. So make sure you follow that protocol. Radioactive hazards. So radioactive materials are used to perform diagnostic tests and deliver treatment. So phlebotomists may be exposed to small amounts of radioactive materials when drawing blood from a patient receiving radioactive treatment, or if that patient is undergoing imagery with a radioactive substance. Radioactive hazard guidelines. So make sure you recognize the radioactive hazard symbol. Exercise extra caution in areas that actually use radioactive materials. Generally, laboratory staff aren't going to be allowed in those areas. But for some reason, if you are, make sure that you are following their protocols. Make sure you learn the institution's procedures for minimizing exposure and responding to accidents. And pregnant women in the first trimester should not enter a patient's room or a laboratory facility if there is radiation alert posted on the door. This precaution is in place because it can help to prevent a possible adverse effect on the baby or the fetus. Electrical hazards. So electrical hazards in the laboratory may result in shock or fire. So we want to avoid using extension cords. We want to report any frayed cords, any overloaded circuits, and ungrounded equipment. We also want to make sure we unplug equipment before servicing it. We do not open equipment marked with an electrical caution warning, and know the location of the circuit breaker box just in case we do need to cut electricity. And also make sure to avoid contact with electrical equipment while drawing blood. Emergency response to electrical shock. So if an electrical shock does occur, you're going to want to turn off the equipment, either by pulling the plug or switching off the circuit breaker. Do not touch the victim until the risk of further shock is removed. And you're going to call 911 and start CPR if needed, and try to keep the victim warm. If you cannot turn off the electricity, you're going to break contact between the source and the victim using a non-conductive material like a wooden broom handle. Electric shock can also cause tissue burns. Tissue burns caused by electricity can be extensive, with extremities being the most vulnerable. Fire and explosive hazards. So fires or explosions in the laboratory may occur as a result of chemical or electrical accidents or carelessness with flames or other fire sources. So we have an acronym to help us remember what to do in case of a fire, and that is RACE, which stands for Rescue, Alarm, Confine, and Extinguish. Rescue means to remove patients from any area where the fire risk is present. Alarm is when you call 911. Confine is when you close all doors and windows. And extinguish, if the fire is small and contained, you can use an extinguisher or blanket to try to put it out. Another acronym to remember is PASS, and this is how to use a fire extinguisher. So PASS is pull the pin, aim at the base of the fire, squeeze the handle, and sweep. There are different classes of fire as well. So you have a class A, which is usually caused by wood, paper, and cloth. And you would use a class A or ABC extinguisher to put that out. Class B is grease, oil, and flammable liquids. You would use an ABC, BC, or halogenated agent to put that out. Class C is energized electrical equipment, and you would use a C extinguisher to put it out. Class D is flammable met, which is you would use D extinguisher and special equipment to put this one out. And Class K is cooking oils and grease, and this would be you would use a K extinguisher and special equipment to put this type of fire out. Magnetic resonance imaging hazard, so MRI. The instructions of the MRI staff must be followed to prevent serious injury or death. Now, generally with MRI, we as lab staff are never going to be allowed in the actual MRI room. So just kind of remember that. But the MRI does use powerful magnets to create images of the body. Precautions need to be taken to avoid serious risk. All metallic objects need to be removed, and anyone with an implanted metallic device may be barred from entering. Emergency first aid procedures. So we have CPR. So determine if the patient is conscious. If the patient is breathing normally, you're going to perform chest compressions. For bleeding, elevate limb and apply direct pressure until medical assistance is available. And if they are in shock, you can call for assistance, keep victim lying down, elevate legs, keep warm, and keep airways open. Now remember, you will need to follow your facility's protocol, so these may be a little different depending on where you are working at. Disaster emergency plan. So most institutions actually have a disaster emergency plan that will describe the procedures in the event of a large-scale disaster like a flood, hurricane, fire, or earthquake. Your responsibilities may range from just reporting to a specific place or person outside of the facility. Like in the case of a fire, if you think back to elementary school, they had to report, at the slide or something like that. And your responsibility could also be to help remove patients from danger. It's really just going to depend on the facility protocol and procedures on what you should or shouldn't do. So make sure you pay special attention to what your responsibilities actually are and know what to do in those types of situations, because when a disaster does happen, it gets a little chaotic. And when things get a little chaotic, it's kind of hard to remember what you're trying to do if you don't really know what you're supposed to do in the first place. So make sure that you know what those responsibilities are and have a plan in place. All right, so sensitivity to latex and other materials. So most healthcare facilities today actually have stopped using latex gloves and have started to use stretch nitrile or vinyl gloves for this reason, because some people do have sensitivity to latex. So it can cause an irritant contact on the skin, and it's a reaction to direct skin contact with materials left on the latex during manufacturing. Symptoms can include redness, swelling, and itching within minutes to hours after exposure. So washing the exposed area can actually help reduce that irritation within several hours. Allergic contact dermatitis is a true allergic response to the proteins of latex that are absorbed through the skin. And they can actually have a life-threatening reaction called anaphylaxis, and that is when the airway actually swells shut, the heart rate increases, and blood pressure actually drops. So these people would generally need an EpiPen or an epinephrine injection and a trip to the emergency room if anaphylaxis does occur. So make sure you know what materials you're using and make sure they don't contain latex, especially if you see a latex allergy sign or wristband on a patient. Preventing latex reactions. If someone is latex sensitive, they will wear, like I mentioned, a medical alert bracelet. You can ask the patient about any latex allergies, especially like in an outpatient setting when they don't necessarily have a wristband on. Patients should also be asked about any reactions to chestnuts and fruits such as bananas, kiwi, and avocado.